My name is Victoria Davis, and today I'm going to discuss Black Maternal Health Week. Black Maternal Health Week is observed every year from April 11th through April 17th, and it was founded by the Black Mamas Matter Alliance. It is intentionally held during the National Minority Health Month, and it is a week long campaign to build awareness, activism, and community building to amplify the voices, perspectives, and lived experiences of Black mamas and birthing people. Black women in the United States experience a significant higher rate of adverse pregnancy outcomes compared to other women from other racial and ethnic groups. Per the CDC, 50,000 women in the United States suffer complications from pregnancy each year. And Black women are 3 times more likely to experience complications from pregnancy compared to white women. The maternal mortality rate for Black women is estimated to be 55.3 per 100,000 live births, equating to 1,800 maternal deaths each year. Mental health conditions affect 1 in 5 pregnant Black women, and that's also the leading cause of Black maternal mortality. Let's discuss strategies that can be used to achieve the goals to decrease or end Black maternal mortality. So, a downstream strategy would be patient and family education. This would involve educating the patient or the family when to seek help, such as like signs of maternal complications. This would be during pregnancy and also in your postpartum stage. So things like trouble breathing, severe nausea and vomiting, vision changes, fever, severe belly pain that does not resolve, headaches that don't resolve, and any vaginal bleeding or leaking during pregnancy. And this would also encourage the patient to advocate for themselves and encourage the family members to advocate for their loved one. Midstream strategy would be to increase prenatal clinics for women to receive more health care, the placement also of these prenatal clinics. Black people tend to live in areas that have decreased access to health care. Also, implicit bias training for providers. So, this would be like your unconscious stereotypes that affect your understanding and decision making, which can also contradict your conscious values, things that you know that are right, and to improve delivery of prenatal, perinatal, and postpartum care. Upstream strategies would be the increase of doulas and midwives. So, a doula is a non clinical trained professional who provides physical, emotional, and informational support during pregnancy, delivery, and after childbirth. The use of a doula is known to increase patient outcomes. And midwives, they have a range of services for pregnant and postpartum care. They are an advanced practice registered nurse, and actually, to extend the Medicare services that are covered by doulas, so only 26 states out of the 50 states reimburse for doula care. And while all states cover midwives under Medicare, there are varying scopes of practice and reimbursement rates for those midwives. Social support, so this would be like your social determinants of health, transportation, housing, and food. If we were to increase the social support, more women would receive better care. They would be more or less apprehensive to receive this care also. Okay, let's discuss issues in Black maternal health care. So, one issue is implicit provider bias, which can also lead to inequitable levels of suspicion. So, this would be For instance, Black women are perceived to be stronger and being able to tolerate higher levels of pain. So, if a Black woman came in complaining of pain, the provider may believe that she is just pain seeking for medication. This is going to cause a delay in diagnosis and treatment. Also, racism, health disparities. Black people tend to live in areas with limited health access, so this can cause an increase in poor health outcomes. Informed consent. A survey that was performed said 2 out of 5 women said that they had procedures that were performed while they were in labor without their consent. So this could be things such as like episiotomies or C-sections, just not having the provider explain things well enough or not having them explain things to you at all. This is going to deprive a woman of the autonomy of choice over her body. Also, not having the proper education in your birth planning, so such things as home births, discussing the C-sections, assisted birth, not giving enough information or guidance or giving any of that information at all, not allowing a patient to be involved in their care and to make decisions for themselves. And all of these can lead to miscommunication and trust, which overall can cause delayed interventions and treatments, inadequate pain relief, and also the patient feeling unheard, which is going to lead to poor health outcomes and even death. Ethical and political considerations. So let's discuss the Momnibus Act. This act was introduced to Congress in 2023. States that 80% of maternal deaths can be prevented. And since its inception, the Black Maternal Health Caucus has enacted over $200 million, dollars, and it is comprised of 14 individual bills. So some of these bills include increasing investments that are necessary for social determinants of health. So, like we were discussing before, food, transportation, housing. Also, extending WIC eligibility in postpartum and breastfeeding periods. Increasing the funding to improve maternal health care for vets. This actually did get passed in 2021. To improve the maternal health care for incarcerated moms. Investing in research to reduce preventable cases or causes of death, to grow and diversify the workforce so that moms can receive care and support from people that they trust, and to support moms with maternal mental health conditions and substance use disorders. Some organizations that have been founded to increase the awareness of Black maternal health issues and mortality are the Black Mamas Matter Alliance, which I stated previously. They founded the Black Maternal Health Week. Their goal is to build skills to end Black maternal mortality. Also, the Black Maternal Health Caucus is their goal is to elevate America's maternal health crisis within Congress. The CDC Hear Her campaign raises awareness of urgent maternal signs during and after pregnancy. And also, the National Birth Equity Collaborative is their goal is to produce better birthing outcomes for Black birthing people and also to help prevent infant mortality. And a way to help these organizations reach their goals is to increase funding, data collection and support, and also research. These are the references that I used to create this presentation, and thank you for listening. I hope you learned something today.